Last Tuesday, a woman named Dorothy in Burlington, Vermont, sat down at her kitchen table. She opened a letter from her Medicare Advantage plan, and what she read made her hand shake. "We regret to inform you that your plan will no longer be offered in your area." Dorothy is 74 years old. She has diabetes. She has high blood pressure. That Medicare Advantage plan covered her insulin. It covered her dental cleanings. It covered her eye exams. It covered her rides to the doctor. And just like that, it was gone. Dorothy is not alone. Close to 3 million seniors across this country received a letter just like hers this year. And here is what frightens me. Most of them do not know what to do next. And the biggest danger is not the letter itself. It is what happens in the 63 days after that letter arrives. And I am Honey, and I have spent years studying Medicare rules, Social Security policies, retirement finance, and the regulations that affect your life after 65. I break down complicated government rules into simple steps so you can protect your money, your health coverage, and your peace of mind. Now I want you to take a breath right now. Because yes, this situation is serious, but there are protections built into the law that most seniors do not even know exist. And in this video, I am going to walk you through every single one of them. I am going to show you exactly what is happening with Medicare Advantage plans in 2026. I am going to explain the 3 hidden traps that are catching millions of seniors off guard. And I am going to give you a clear 3-step action plan to protect yourself. But I need you to stay with me all the way to the end of this video, because there is one critical deadline that, if you miss it, you could be permanently locked out of affordable health coverage. I am not exaggerating. The word permanently is not clickbait. It is federal law, and I will explain it fully. Let us start with a story. Robert is 68 years old. He lives in Concord, New Hampshire. He retired 3 years ago from a career in manufacturing. He is a careful man, pays his bills on time, keeps his paperwork organized. When Robert turned 65, he signed up for a Medicare Advantage plan. It had a $0 premium. It covered his prescriptions. It included dental and vision. It had a nice out-of-pocket maximum, so he would never face a surprise medical bill he could not handle. It seemed like the obvious choice. He never bought a Medigap policy. Why would he? His Medicare Advantage plan was covering everything. For 3 years, the plan worked perfectly. Then, in the fall of last year, Robert received an annual notice of change from his insurer. The letter explained that his plan was leaving New Hampshire. His county would no longer be served. Robert was not happy, but he figured he would just switch to original Medicare. Same thing, right? Medicare is Medicare. Wrong. Robert switched to original Medicare. He did not buy a Medigap supplemental policy because he thought he could do that anytime. He did not sign up for a standalone Part D drug plan because he assumed his prescriptions were still covered. 3 months later, Robert needed a heart procedure. The bill came. Under original Medicare, he owed 20% of every cost with no cap. His share came to over $27,000. He tried to buy a Medigap policy to protect himself going forward. The insurance company ran his medical history, diabetes, heart condition. They denied him. Robert had missed his 63-day guaranteed issue window. And under federal law in most states, that denial was perfectly legal. Now, I am telling you Robert's story not to scare you. I am telling it because his situation was completely avoidable. Every single mistake Robert made has a solution written into the law. He just did not know about them in time. Let me make sure that does not happen to you. Let me start with what is going on and why. Medicare Advantage, also called Part C, is not government-run Medicare. It is a private insurance plan approved by Medicare. A private company receives a fixed payment from the government for each person enrolled. That company then provides your Part A hospital coverage, your Part B medical coverage, and usually your Part D drug coverage, plus extras, like dental, vision, and hearing. Over half of all Medicare beneficiaries in this country are on Medicare Advantage plans right now. More than 35 million people. Here is the problem. In 2026, a massive wave of these private insurance companies decided to pull out of counties across the country. They stopped offering their plans in entire regions. According to a peer-reviewed study published in JAMA by researchers at Johns Hopkins, approximately 10% of Medicare Advantage enrollees are facing forced disenrollment this year. That is up from about 1% per year between 2018 and 2024. We went from 1% to 10% in just 2 years. The Kaiser Family Foundation confirmed that 2.6 million people were in plans that terminated coverage at the end of 2025. In 12 states, more than 1 in 5 enrollees lost their plan. And in Vermont, 93% of Medicare Advantage enrollees were affected. 93%. Now you are probably asking, why is this happening? There are 3 big reasons, and they all come from changes in federal policy. First, the Inflation Reduction Act put a cap on what seniors pay out of pocket for prescriptions. That cap is now $2,100 a year. That is great for you. But the insurance companies now have to absorb the costs above that cap. The government did not give them extra money to cover it, so their expenses went up. Second, the government changed how it calculates payments to these companies. It is called the V28 risk adjustment model. Under the new rules, thousands of medical diagnosis codes were removed. That means conditions like diabetes with complications and certain heart diseases no longer bring in the same level of federal payment to the insurer. The companies are getting paid less to care for sicker patients. Third, the government proposed almost flat payment rates for Medicare Advantage in 2027, just a 0.09% increase. After insurers got a 5% increase in 2026, that signal tells them profit margins will keep shrinking. So they are pulling out of markets they consider unprofitable, especially rural areas and smaller counties. The Medicare Payment Advisory Commission estimates the government is spending $76 billion more on Medicare Advantage enrollees than it would if those same seniors were on traditional Medicare. That political pressure to reduce overpayments is making the situation worse. Now let me explain the traps, because this is where most seniors get hurt. Trap number 1. Many people think switching to original Medicare is no big deal. It is the same Medicare, right? No, it is not. Original Medicare has no annual out-of-pocket limit. Let me say that again. There is no cap on what you can owe in a year. You pay 20% of every Part B service with no ceiling. 1 major surgery, 1 cancer diagnosis, and you could owe tens of thousands of dollars. And original Medicare does not cover dental. It does not cover vision. It does not cover hearing aids. 98% of Medicare Advantage plans covered those benefits. When you switch to original Medicare, those benefits vanish. Trap number 2. This is the most dangerous one. Many seniors believe they can buy a Medigap supplemental insurance policy whenever they need it. That is false. According to the official Medicare guide, your best chance to buy Medigap is during a one-time 6-month open enrollment period that starts the month you turn 65 and sign up for Part B. That period does not come back. Outside of it, insurance companies can use medical underwriting. They can look at your health history. They can deny you coverage. They can charge you more. If you are 75 with diabetes and a heart condition, they can say no, and that no is legal. Trap number 3, some seniors get the letter, feel overwhelmed, and do nothing. That is the most dangerous choice of all. If you do not actively choose a new plan during your special enrollment period, you are automatically placed into original Medicare with no supplemental coverage and no drug plan. You just fall through the cracks. Trap number 4. While about 98% of doctors accept Medicare, that does not mean your specific cardiologist, your oncologist, or the hospital system you have been using will work the same way under original Medicare as it did under your Advantage plan. You may lose your coordinated care network, but here is what I really need you to hear. The law does protect you. You just have to act within the right window. If your Medicare Advantage plan is leaving your area or its contract is not being renewed, federal law gives you what is called a guaranteed issue, right? That means any insurance company that sells Medigap in your state must sell you a policy. They cannot deny you for pre-existing conditions. They cannot charge you more because of your health. You can apply for Medigap up to 60 days before your Medicare Advantage plan ends, and no later than 63 days after it ends. That 63-day window is your lifeline. Miss it, and in most states, you lose this protection, potentially forever. You also have a special enrollment period to join a different Medicare Advantage plan if one is still available in your area. And for 2026 only, if you chose a plan based on incorrect provider directory information in the Medicare Plan Finder, you can switch during a brand new special enrollment period. Some states like New York, Connecticut, and Massachusetts offer additional protections. Your state may have rights beyond federal law. All right, let me give you your 3 steps right now. If you do nothing else after watching this video, do these 3 things. Step 1. Find out exactly what plans are still available in your area today. Go to Medicare.gov Plan Compare. Enter your zip code. You will see every Medicare Advantage plan and every standalone Part D drug plan available where you live. You can compare them side by side. Also go to medicare.gov Medigap supplemental insurance plans to see which companies sell Medigap policies in your state and what they cost. Do this today, not tomorrow. Today. Step 2. Call SHIP for free, personalized help. SHIP stands for State Health Insurance Assistance Program. These are trained counselors funded by the federal government who help seniors with Medicare decisions at no cost. They are not insurance salespeople. They do not work for any insurance company. They work for you. Go to shiphelp.org to find your state's program or call 1-800-MEDICARE. That number is 1-800-633-4227. Tell them your plan was terminated and ask them to walk you through your options, including your Medigap guaranteed issue rights. Step 3. Mark your 63-day deadline on your calendar right now. This is the most important step. From the date your Medicare Advantage plan coverage ends, you have exactly 63 days to apply for a Medigap policy under your guaranteed issue right. Write that date down. Put it on your refrigerator. Set a phone alarm. Tell your spouse, your children, your neighbor. Because if you miss this deadline, you may never get this chance again. In most states, once this window closes, insurance companies can legally deny you Medigap coverage based on your health history. And that denial can last the rest of your life. Let me also say this. If you have a loved one who is on Medicare, a parent, a grandparent, an aunt, an uncle, please share this video with them. Many of the people most affected by this crisis are in their 70s and 80s. They may not be watching YouTube. They may not know their plan was terminated. They may not understand what the letter means. You could be the person who saves them from financial disaster just by sharing this information. Now, before I let you go, I need to tell you something important. Medicare rules change. Social Security rules change. Banking regulations, insurance policies, pension laws, they all change. Sometimes overnight. And YouTube will not always show you my videos. The algorithm decides what you see. Notifications get buried, and by the time a video reaches you, a critical deadline might have already passed. That is why I created something specifically for our community. I have set up the Global Senior Alerts official WhatsApp channel. When you join, you will be able to download a free senior benefits protection guide. This guide covers your rights under Social Security, Medicare, Medigap, pension laws, banking rules, and more. It is written in plain, simple language, and it is yours to keep. You will also receive real-time alerts whenever there is a new rule change, a new deadline, or a new threat to your benefits. No ads, no spam. Just the information you need to stay protected. The link is right there in the description below this video. Click it now, join the channel, download your free guide, and make sure you are never caught off guard again. Now, I'm going to ask you to do one more thing for me. If this video helped you, if it cleared up something that was confusing you, hit the subscribe button right now. And hit the bell icon so you actually see my videos when they come out. Every week, I break down the rules that affect your retirement, your benefits, and your financial security. And I do it in a way that is simple, honest, and based on verified facts from official government sources. You worked your whole life. You paid into this system for decades. You deserve to understand how it works, and you deserve someone who will tell you the truth. I am Honey, and I will see you in the next one.